Hello and welcome to Stylist from the Break Room. I'm Eddie Ohanian. I have a special guest with me today, Chad White from Zenagen. We're talking once again about breast cancer awareness and how to participate in breast cancer, not just be an observer and be aware of it. So Chad, thank you for joining us today. How are you, buddy?
Good, good. Happy to be here. This is definitely an important conversation that, any stylist who's been in the industry for any length of time has, had this come up from a client, family member, or somebody that they, have in their life personally.
Very much. And seeing that October is the official Breast Cancer Awareness Month, it's a good opportunity now, since a lot more people are tuning in, to bring that awareness a lot higher and show people how they're able to participate. So I just want to start off with introducing you to the audience. Tell us a little bit about yourself and your brand that you represent, and how that is tied in, how that relates to and is tied in to help with breast cancer.
So my name's Chad White. I have been a stylist behind the chair for 33 years this year. So been behind the chair for quite some time, and I'm the Director of Education for Zenagen. And we are a botanically based hair and scalp care company. And our brand's entire focus and purpose, if you will, is to help the scalp achieve optimum health by using powerful botanical formulas to help provide calming, soothing, help to alleviate any inflammation or irritation in the scalp that is going to impede or hinder hair growth under best circumstances. And especially for people undergoing, treatment for breast cancer or other cancers even. We, of course, would want them to make sure that they get approval from their doctor to use the product, just to be safe and make sure everybody's bases are covered. But to have these botanically based formulas that are very calming and soothing to the skin are definitely a benefit to be using on your hair and scalp as you're undergoing treatment.
It's a huge benefit for anybody and everybody out there, and especially because once, unfortunately, somebody's going through treatment, obviously you're going through it for the best reason possible and for the best outcome possible. But you're right. People do get nervous, and doctors do take extra care and precaution. You don't want to be introducing foreign variables. So we start to see a lot about the health consciousness in products, in relation to the ingredients in products, looking for that cleaner version or that less active ingredient version. And that's one of the things in particular about Zenagen that has always fascinated me, is that it's primarily works with frequency of use rather than per se an active ingredient that does all the work. Can you speak to that a little bit more?
Yeah, absolutely. So being a plant-based company, we don't have any hormones, chemicals, or medications that would cross the blood barrier or do any sort of like instantaneous type relief or treatment to the scalp. So the key with using any botanical formula is consistency and regularity of use. So whether it is utilizing the recommended every other day shampoo and condition cycle with one of our products, or if you're working our scalp serum into your regimen to stretch between shampoo days, getting those botanicals on your scalp regularly and following, the 5-minute time frame that we need the shampoo to be on the scalp for, or regularly applying the scalp serum, consistency is key for those botanicals to be able to have their intended benefits on the scalp.
It's huge. That's very, very huge. And I love you use the word, crossing the bloodstream. So it's so vital because there are a lot of treatment products and hair, scalp conditioning and hair regrowth products such as your brand that focuses on, you have to ingest, you have to take internal, some kind of pill or some kind of something with it. So the fact that yours is just contact, it's just surface contact, it's not focusing with anything internal is huge. It's very, very huge. With that said, how long does it take realistically for somebody to see results on average?
Well, in terms of with cancer treatment, that would be because depending on the type of treatment they may be receiving, sometimes people's hair is more likely or less likely to survive that treatment process, depending on that type of treatment. But definitely, having a product that helps calm and soothe the scalp so that those follicles can receive the full blood circulation and everything that it needs to get the nutrients and oxygen that's necessary to build that hair, is definitely a benefit. And like we said before, like the regularity of use, we recommend an every other day shampoo cycle or 48 hours or daily use of the serum, because it takes your body about 48 hours to start breaking down anything that you put on or apply topically.
Hmm.
So that's another thing about Zenagen that's really great, because these people who are undergoing treatments are, they're taking in a barrage of medicines and chemicals and things like that are, can be toxic to parts of their body that they're fighting, but yet support, to help cure them. So it's nice to have something that's not, I guess what I'm trying to say is that the patient can use these, or the client can use these, and not have to worry about any sort of interaction with any sort of other medications or treatments that they're going to be using. So it's not like we don't have to worry about anything creating bigger problems by interacting with anything.
Yeah, that's really powerful. That's really, really powerful. When somebody is first diagnosed, their whole world kind of turns inside out and upside down, and we see that a lot of decisions needs to be made in regards to when to use these kind of products. Should the person start using it immediately? Should they wait till they get into treatment? At what point in the process should they consider start using these kind of products for maximum effect?
Well, if they can use them before they, if the window of time allows and they can start these products before they start treatment, I mean, I think that would probably be beneficial to just get some calming and soothing benefits into that scalp before they would have the inflammation and irritation hit from, the cancer type treatment. So I think if they could start it beforehand, that would be great. But if they're already in treatment, the first thing I would want to know is their hair likely to stay or fall out, and if their doctor is okay with them using it. And then if their hair is likely to stay, we're going to get them on a shampooing, the Revolve shampoo and conditioner treatment to help keep that hair in their scalp and keep it flourishing. But if they're going to be receiving a treatment, or they're already past the point where they're losing hair, or if the hair loss is going to happen, then I'm going to want them, again, with the doctor's approval, to get them on that serum daily, so that it can just provide additional relief and calming and soothing while they're undergoing treatment. And particularly because the scalp is structured so different than the rest of their body, like this part of our scalp up here, the way it's structured without any lymphatic drainage, it really does hold on to toxins and irritants much longer than other parts of the scalp. In my time behind the chair, I've noticed that whether it's breast cancer or other cancers, what have you, I've noticed that when people's hair starts to grow back, it kind of starts down here at the hairline, filling in around here first, and then it kind of creeps towards the top. And then when it gets to this area right here, it kind of slows down and can stall a little bit. And that's just because up here, we don't have any lymphatic drainage. So there's no cleanup crew working in this part of the scalp. So that's why even, for people under, scalp massage is always important for scalp health. But especially for people undergoing treatment, scalp massage that they can tolerate is super important, because sometimes the treatment can make their scalp very sensitive to touch. So of course you don't want to be doing scalp massage if it hurts. But if you can incorporate that into your treatment routine, whether you're using the serum or the shampoo and conditioner, it's going to help your scalp receive the optimum benefits
I
from the
love that.
system.
That's really powerful stuff, because if you think about it, in particular, there's a nonprofit organization called HairToStay. and they work with cancer patients going
Hmm.
through, especially chemotherapy and radiation as well too. In essence, they have this cold cap technology, and they help offset the cost and provide those services to people who can't afford it. And that cold cap technology and service, or that treatment does, similarly to what you're describing,
Hmm.
it helps soothe the scalp and calm it down to offset some of the sensitivities
Hmm.
that are harbored and created from going through the heavy treatments that a lot of these people have to go through. So similarly, Zenagen being able to reduce inflammation, and you're being able to use that throughout the week, and then on your treatment day, you use the cold cap,
Hmm.
that combination, I love that one doesn't overwrite or interfere with the other. It's actually synergizes, if you will. Is that the right way to say it?
Yeah, because the that cold cap really works. It's some pretty cool technology that works with that because it really works on um, using the cold to restrict those blood vessels in the scalp during treatment. So it helps limit, and I could be wrong, but this is the way my brain understands it. The restriction in the blood vessels from the cold and in the tissues really inhibits the body's ability to push the medications that are in the chemo up into the very tiny blood vessels of the scalp. So that cold almost acts like a physical barrier that restricts the blood vessels so those medications can't get into that area. And then, because I believe you even have to wear it for a certain amount of time
Amount of time.
after your infusion, of your medication so that, it has time to do what it's going to do as well. So, and a lot of people, I don't think they realize that to undergo these cold calf treatments, that adds hours to your medication infusion. I mean, this isn't like you're just slapping on a stocking cap. This is a process. I've seen units, where you're almost carrying a little cooler full of ice water that's circulating through the network of tubes and these cold caps. So it's quite the system, and it's the fact that it allows women with some cancers and undergoing some treatments to retain their hair is pretty cool because that hair, not that it's not like this for everybody, but I think even more so for women, it carries a deeper sense of identity and self and who they are. And especially for breast cancer, when a woman can feel like her very body is turning on her, I think the ability to keep their hair would be a pretty powerful place to be able to say like, "Ooh, I'm still me. I still feel and look like me." So yeah, it's a really neat science that has finally caught up with the world today.
It really is. It's fascinating. The way technology has improved and the way quality of life has improved has been absolutely
Hmm.
incredible, and in the most positive way possible. The One of the other things I like about the Xenogen system in general, the serum that you keep mentioning for daily use
Hmm.
is with the delivery system for it is with an eyedropper, and
Correct.
then you just have to massage it in.
Hmm.
And then, but you don't have to spend a lot of time massaging it in.
No, no, it utilizes a white tea system in the serum to help it absorb into your skin as quickly as possible. And it's water and aloe based, so there's no oily residue. A lot of people, when they hear a scalp serum, they immediately jump to an oil based type treatment. So this is water and aloe, and it really leaves the skin feeling. Um, if you've ever put any sort of like alpha hydroxy, anything on your face, that really smooth, almost powdery finish it gives your skin, that's the feel that the serum leaves behind. So it really is very lightweight, and the tip of the dropper is very tiny, so you can keep that application pretty precise, whether you're doing a spot treatment. But if somebody is undergoing some sort of chemo treatment or radiation, I would probably recommend that they do a total scalp application, and then just rub it in lightly afterwards to make sure it penetrates and into the skin.
I mean, I love the way it reduces inflammation and irritation.
Hmm.
So between talking about the cold cap and how using the cold to shrink the blood vessels so it doesn't enlarge and inflame and push against the hair shaft, and then supplementing in the serum daily
Hmm.
use. And then every other day, the revolve, leaving only having to leave it on for 5 minutes,
Hmm.
but you don't have to massage it in for 5 minutes. You just have to massage it in
No.
for the first, what, 30 seconds?
I like to ask clients if they'll give me 1 minute.
Okay.
That is like, so if they say they'll give me 1 minute, likely I'm going to get 30 to 45 seconds in reality. Um, so which, I'll take what I can get. But especially in terms of scalp massage, yes, the scrubbing motion that we're doing to cleanse our scalp is really good. Um, but if you're going to do scalp massage, and I wish I had my Zenagen scalp massager, but even if you don't have a Zenagen scalp massager, any scalp massager, give yourself a little grip like this, and then just put it on your scalp and rotate. It's not about rubbing your scalp. It's more about almost like this type of motion all over your scalp to compress and release your scalp. Because this type of motion right here helps compress the circulatory system of your scalp, which then in turn causes the circulatory system to pull in the toxins from around it and then flush it out farther down in the lymphatic system. So that scalp massage, especially if you're undergoing treatment, so if this were my client in my chair, our conversation would go, okay, your treatment is on Tuesday. You wear the cold cap for this many hours. That next day, I would like you to do 2 or 3 times. If you can tolerate, as long as their scalp isn't too sensitive or irritated, if they can go in and give me 30 seconds of this 2 or 3 times a day, that is going to absolutely help their overall scalp health and hair retention. Because that scalp massage is, our industry has kind of been slacking, for lack of a better word, on the importance of scalp massage and us talking about it. But especially with our guests that are undergoing treatment for cancer or any medical issue, we really need to make sure we have that conversation because it's the most impactful thing they can do that doesn't cost anything, you know. So it really is important in helping protect that circulation and help flush that inflammation and irritation out of the scalp.
I love how you're breaking it down into a routine,
Hmm.
mentioning that you just want them to do a little bit of that massaging if they can handle it
Hmm.
twice a day, maybe 3 times a day. I think a lot of people don't realize, or as stylists, sometimes we forget when a woman's going through those treatments, especially their upper torso region,
Hmm.
it's painful.
Hmm.
It's they lose a lot of their core strength, they lose a lot of rotation,
Hmm.
and being able to lift their arms up, it is extremely taxing
Hmm.
while they're going through treatments. And I don't know if just enough people aren't aware or if they don't think about it enough. So I love the fact that you're saying you only have to do it for about a minute and you just have to try to do it maybe 2, 3 times a day.
Yeah. Yeah. Because we don't, these people are already going through so much. We don't need to tackle some, you know, extravagant scalp care routine on top of them. And, quite honestly, that's what, in my opinion, a lot of the medicated systems that a lot of people will, for lack of knowing better, will gravitate to. And not that they're bad or not that they're wrong, but a lot of times with those, if you're somebody doing a treatment for something else, and then to start a one of those medicated hair loss systems, with the medicated systems, you're committed to a shampoo regimen every day, and there's usually 1 or 2 steps, maybe even 3 with that. And then there's going to be some scalp drops that you have to put on at least once or twice a day. Um, so like Zenagen is just a once a day when you're washing your hair normally or when you're putting your serum on normally. So it's a time saver and it doesn't muddy up your life with more unnecessary steps.
So we've been focusing a lot on the loss of hair and the
Mhm.
regaining of hair. But then we have seen great successes with the cold cap technology as well too, where a lot of women are just shedding. They're not necessarily losing, or the hair is not
Mhm.
completely falling out. And I don't think enough credit is given to the Zenagen system. Um, it focuses so much on regrowth, but I think equally as important, it does help in eliminate shedding, or at least offset or slow down the shedding process.
Absolutely. One of the things that I love most about Xenogen is that it does not always have to be reactive. It can be proactive.
Okay.
So if you've got somebody, because everybody, if you're a stylist behind the chair or a client watching this right now, like we know that clients tell us some things. They share things that, break our heart, make us happy, shock us, make us need to go to the back room and say, "Dear Lord, I've never heard that before." We hear all of those things from our clients. So we know when they've had to go get a biopsy. We know, and when we hear those conversations, that's when the conversation about Xenogen needs to start. It doesn't need to start with, "I saw my oncologist." It needs to start with that appointment where she tells you that her mammogram went sideways and she's got to do a follow-up biopsy. That's when we're going to start talking about it, not when the house is on fire, but hopefully before the house catches fire.
You mentioned something really important there. You just reminded me. You had taught me this a long time ago. An event, when it occurs to the body and it puts the body into some kind of a system shock,
Hmm.
sometimes doesn't manifest and show the symptoms up to 6 months later.
Hmm.
So is that kind of what you're talking about too with being proactive?
Absolutely. Especially like if there's biopsies or surgeries involved, anesthesia, any hairdresser knows that anesthesia, you know, anywhere from 6 to 18 months later can trigger a shed cycle in somebody because of those heavy metals that build up in the circulatory system. Um, and if we can help prevent those things from building up, we can hopefully help them retain some hair and keep that a little, keep their luscious locks a little luscious for as long as possible, I guess.
It's important. It really, really
Hmm.
is important to take that proactive approach.
Hmm.
And I love how versatile the product is, and the
Hmm.
brand is for that matter, especially with how much science is behind these ingredients.
Yeah. And it kind of, what's that old saying, an ounce of prevention is worth a pound of cure.
Mm.
That's, and whether it's breast cancer or your client tells you that I'm having hip surgery or whatever, or, maybe it's somebody who maybe they're not having breast cancer, but it's somebody that they're close with. You can send a care package to them, but maybe the stress and emotional upheaval is going to cause your friend who doesn't even have undergoing treatment, some hair loss if they're that close to that person. So it really is, to me, that's like the secret power of Xenogen, really, is that it doesn't always have to be the, "Oh my gosh, I've lost my hair, I'm shedding, what can we do to make it better?" It can be the, "Hey, I've got this storm of chaos coming. Is there anything that we can do so that I don't have a shed cycle when it's coming?" So the the proactive nature of our brand, to me, is almost its secret weapon.
It really is. And then staying on that same note, on that same idea. So you start doing the proactive approach. So now when treatment starts, they're already a little bit ahead of the game.
Hmm.
The great news, especially with medical science nowadays, is you may have to stay on treatment forever,
Hmm.
but then we are seeing a lot of successes with women being able to go into remission
Yes.
and not having to stay on treatments forever. Are they two different scenarios, or I get like because the question is, in each scenario, how long should somebody keep using Xenogen after treatment, or is that something that's recommended to stay on it?
Well, for me, really, Xenogen is like a lifetime brand. You know, everybody has different stages in their lives where you might want products for different volume or for different visual effects on your hair, so to speak. But I really don't know anybody that really says, boy, I can't wait till I'm older and my hair thins out. You know, I've never, in 30 plus years behind the chair, I've never ever heard that phrase be spoken. So really, you know, it really is a product line that is so scalp health focused. Like I always like to say, Zenagen's real mission is to create a scalp so healthy that your body can't help but produce the best hair possible.
Mm.
So that to me is more like we're tending to the soil of the garden train of thought versus let's prune the shrubbery that we've grown, so to speak, you know. So Zenagen to me, you know, and I'm a gardener, and you know, we got tomatoes coming out of our ears right now in the middle of August when we're doing this interview, but like to me, that gardening and scalp awareness analogy really goes hand in hand.
It does, sure.
Because the scalp is where hairdressers grow the crop that we use to become profitable and make money. So if we're caring for where our crop comes from, the rest will just fall into place. You know, and Zenagen's also not going to cannibalize, you know, whatever other shampoo, conditioner, system company you have in your salon. Zenagen is just going to come in there and be that scalp care partner for it, rather than coming in and being like, oh, I'm going to kick all the other products off your shelves.
You know, that is so true. I'm glad you brought that up. This doesn't replace, this works in tandem with.
Mm-hmm. Right.
So I tell a lot of my clients, I really do. I tell a lot of my clients, wash your hair with your shampoo that you like first. Get your hair nice and clean. And then go in and do a second shampoo, because I don't think enough people realize or understand when we're talking about the Zenagen shampoo, that in itself is the treatment.
Absolutely.
So use your regular shampoo that you like, clean your hair nice,
mm-hmm.
rinse it out. Now go in with the Zenagen shampoo treatment. Massage that in for a minute.
Mm-hmm.
Let that sit for 4 more minutes. So you got it on for a total of 5. And then you rinse that out and follow up with the conditioner.
Mm-hmm.
You could rinse that out and then follow up again a second time with your regular conditioner that you like.
Absolutely. You know, and I know we mentioned it earlier, but we do always like to encourage a pre-shampoo with Zenagen, especially if you're going more than one day between shampoos. And I get asked a lot, well, why would you do that? You know, what benefit does that have? Well, in my analogy to that is, you wouldn't go to the skincare counter and buy the Miracle Fountain of Youth face cream and go home and put it on a dirty face that has yesterday's makeup on it. It's the same thing with Zenagen. Zenagen is a treatment system, so we want as few barriers between your skin and Zenagen as possible. So doing that pre-shampoo is great. You know, I use very little stylers, and I'm also a daily shampooer because that's just who I am. So, but I will still 2 or 3 times a week at least still use a pre-shampoo, you know, just because it's part of my routine. So daily shampooers, not so much. They need a pre-shampoo unless they're like product junkies, and then use the pre-shampoo. But that pre-shampoo really does, and especially if you happen to use one that has any sort of like menthol or tingle or does anything to help wake your scalp up, that's going to help the Zenagen be more effective, because the more stimulated that skin is as you apply the Zenagen, the more ready it will be to receive the benefits that Zenagen brings.
Makes sense. Yeah, makes sense. And I find that a little bit goes a long way. You really don't need a lot.
Oh yeah, like the standard retail size 6.75 ounce bottle, that's a 90-day supply. So you really don't need a lot, and especially if you're doing that pre-shampoo, because if you're trying to shampoo, you know, Zenagen, because it doesn't have the harsh surfactant, so it's color, perm, keratin treatment safe. Because of that, unless that hair is super, super wet and doesn't have a lot of product in it, you're not going to get a lot of lather. So if you go in to hair that's not been washed in 2 days using Zenagen as your first shampoo, You're not going to get a lot of lather. You're not going to feel the hair conditioning benefits of the shampoo and conditioner. So that pre-shampoo really allows your treatment shampoo or whatever you're using to then go in and be effective.
That's great advice. That's really awesome advice. Do you have any motivation, or do you have any mantra that you stand by that you can share with people?
Um, well, speaking to my fellow hairdressers, I mean, I know this is a breast cancer awareness um, program here, but there's not a lot of signs about that on the scalp. Let's just be honest with that right there. But my big thing, and it's really been my entire career, is that hairdressers, we're the TSA of the scalp. If we see something, we got to say something. If you see a wonky mole, discoloration, any of those things, say something. I've gotten in some skirmishes verbally about this, but I believe our license holds us to a moral obligation to do so. Because like I've been married for 28 years this year, and I know that my wife has no idea if I have any moles behind my ear or on the top of my head, but I know the girl in the salon does. So there's a level of access that we get to people's scalp and stuff like this, that we need to speak up if we say something. So I know that's a little bit more skin cancer type related, but it's still there. And also, and I just recently had the pleasure of speaking with a breast cancer survivors group up down in Memphis, which was really exciting. And this was some advice that I gave because I was speaking at a beauty school, and I was speaking to students, and then the survivors spoke. And the survivors said that this advice that I gave the students was, as far as they were concerned, spot on. When our guests are undergoing treatment, it's very emotional, and it's a very upheaving type of time in their lives. And we typically are the people in their lives who are more honest than a lot of other people in their lives. So I have found in my practice, when these things affect my clients, I don't go into the platitudes of making you feel better with my words. I do, and will continue to tell my clients, wow, that's a really big shit sandwich, and I'm sorry you're eating that.
Yeah.
Because sometimes having that honest acknowledgement, and it gets me choked up because I've had this experience in my chair so many times, but it's that honest acknowledgement that lets you know you're not alone, and that somebody else has gone through what you're going through. And a lot of times as a hairdresser, our position is more there to hold their hand. So it really is, it's a hugely powerful time, and it's a time that our connection with our guests can really shine through. But I think it has to come from that, oh my God, this is awful. You can vent in my chair. You need to punch a pillow. We're going to go do that. You want to go in the alley and smash a bottle into the dumpster. We're going to go do that too. But I think when we approach our guests with that kind of energy, it gives them a freedom to let us know what's really going on, and let them know that, I don't have to be this. Because a lot of times survivors take on this energy of feeling like they have to make the other people around them feel better about their own cancer diagnosis, which is a weird thing, but we all do it. We get hurt and somebody's got to take you to the doctor, and you're like, oh, I'm so sorry, you have to do this for me. So to just, even if it's just another place that they don't have to say, I'm sorry, I'm sick, that's a pretty powerful thing, to me.
I agree with you. I really do agree with you. It's something that teach, and it's something I talk about all the time, is the trifecta, the holy trinity of the relationship of a hairdresser with their clientele.
Hmm.
It's physical touch, it's mental, and it's emotional.
Oh, absolutely.
We really do touch it is a very special relationship that we have all three.
Oh, yeah.
And it's a level of intimacy that is only ever shared with a significant partner, a significant other behind closed
Hmm.
doors. You know, we get that close with somebody. And in some cases, unfortunately, some people, even though they have family in their lives, for whatever reason, they may not feel that level of intimacy or closeness with their own family members,
Hmm.
yet they're able to feel it with us. I mean, that's a very powerful responsibility that is thrown onto our shoulders. And it takes a special type of person to be a stylist. It takes a special kind of mentality to be a stylist. And it is sometimes that brutal honesty becomes so refreshing
Hmm.
in that moment, like you're describing, when they are so vulnerable, and we are there with them, to
Hmm.
be able to hold their hand, to be able to give them a hug, to be able to cry it out with them for the moment, to be able to vent out that frustration or that anger, whatever the emotion is, we are there for them, we are there with them. So it's a very powerful thing, and this is why we do these interviews. It's
Hmm.
why we have this awareness campaign that we're doing, because we want you to participate in awareness. The thing I've been saying constantly this whole month is, don't just know, oh yeah, it's October, I got to donate some dollars, or I got to do something, or I need a ribbon, or I need to buy something pink. Yes, all those things help and they matter and they're appreciated. But don't think that the next person is going to do it. Go out there and do it yourself.
Hmm.
And if you haven't gotten checked, go get checked.
Oh, absolutely.
Doesn't matter if you're 20
Hmm.
years old, if you're 40 years old, if you're 60 years old. It used to be, it was only for the old people would be affected.
Hmm.
Nowadays, everybody's, see, I think everybody was always affected. We just didn't have the news or the outlets like we do
Hmm.
nowadays with social
And,
media and
and
everything else.
testing is so much more advanced. I mean, the statistic, I'm not trying to shift the conversation in the least, but like breast cancer affects men and women,
You know what? Good point.
and
Good point.
30, 40, 50 years ago, maybe that cancer that was found in a man somewhere else in his body may have originated someplace else, maybe in the breast tissue. So it really, primarily, yes, we know it affects women significantly disproportionately than men. I don't want to try and make it like I'm trying to
No, no, not at
change the
all.
conversation, but like it really is, detection is key. If you have a family history, if you have, it's really, and doing everything you can to get the testing and pre-diagnostics that you need to get regularly is so, so important.
It very much is. Thank you, Chad, so much for
Hmm.
joining us today. Thank you for sharing all that knowledge. Very powerful, very insightful knowledge.
Thank you. It was a pleasure to talk with you guys. Always a good time.
Oh, yeah, it always is. And for everybody else watching, thank you again for taking the time to watch this. Check out the Zenagen products. Go get yourself checked out and go out there and make a difference, one person at a time. Thank you so
Hmm.
much for watching.
Thank you.